Hello, everybody. Welcome back for our discussion of some of the COVID research that was presented at the International Stroke Conference 2021. My name is Mitch Elkind, and I have the pleasure of serving as the president of the American Heart Association and American Stroke Association this year. And I'm joined today by Dr. Louise McCullough, who is the chair of the ISC committee this year and put together this wonderful meeting. We also have Dr. Tudor Jovin, who is the vice chair of this year's ISC, and in just a few short years will be doing this entirely on his own. And then we also have today Dr. Peter Panagos, who is the chair of the Stroke Council of the American Stroke Association. So thanks for joining me today, everybody. And I think today we're going to talk about some of the research and also just some of the discussion around COVID with regard to the meeting. And maybe, Louise, maybe I'll just start by asking you, what was it like to be in charge of the ISC during this pandemic?
It was a difficult year, but people came together. The program committee was amazing, instead of doing things in person, doing a lot of things by Zoom, trying to make the sessions timely, interesting, pushing it back a month because of trying to get our virtual format aligned. It's been a challenge, but I think there's been some strengths to this approach as well. We have historically high numbers of people attending, which is great because we can spread more of the stroke science. I think we're seeing a lot of trainees attending because surprisingly, there's a lot of networking because now we're doing networking in Zoom rooms with Meet the Experts, whereas sometimes those experts at the actual in-person meeting may be too busy to speak with trainees and mentees. So I think there's a lot of advantages to doing some of these new structure. And so while it's different, there's also been a lot of learning and a lot of opportunity, I think, in this format. So I think it's been great. And I do think that as we talk about our COVID science, Tudor and I were talking about how a lot of the sessions we did and we designed were designed back in March of 2020. In fact, ISC was probably one of the last in-person meetings before the pandemic. We had it in February in LA, and really the pandemic hit full force weeks after that. So really some of the science that we had originally scheduled, we're now learning so much in this past year. And we can talk a little bit about what we've learned about COVID. And I think, Tudor, you were involved in a couple of the debates.
Yes, I was privileged to be part of a debate session on COVID care. My part of the debate, I debated as an interventionalist the more liberal approach with respect to requirements for general anesthesia, intubation, and general anesthesia for patients with suspected COVID. And that's actually an excellent example of how COVID care is really a moving target, because when this session was planned, the suspected COVID patient was a real patient, whereas now most of the times we know what we're dealing with, whether it's yay or nay, and certainly the fact that now everybody's vaccinated, the level of concern and anxiety about getting infected, especially now knowing very well that PPE works and what kind of PPE to use in order to protect ourselves. So have made the debate a bit more reduced towards in general, is it COVID or no COVID? Should you intubate patients or not? Which is still an unresolved issue. Maybe some of the issues that clearly there was consensus in many points. Perhaps one point that I differed from my opponent was clearly in patients with suspected COVID or COVID. You don't want to convert from awake to general anesthesia during the case. And perhaps the biggest point of debate is how often that happens. My point of view being that it's extremely rare, and even in patients with aphasia, left hemispheric strokes or even posterior circulation. Actually, that happens quite rare. But in general, I think that illustrated very well how much of a moving target this is, and things that we didn't even think about at that time. For instance, all this discussion about whether there is a hypercoagulable state after some vaccines, that was not even something that we were thinking of at the time of the planning. And had we had the vision, the fortitude to include something like that, would have been very inspired. There was another very interesting, and I think that topic will always remain actual, of whether COVID infection is a coagulopathy versus an endotheliopathy, and there's great arguments to be made on either side. So I encourage the audience to log into this debate. It's really interesting. But in general, I think a lot of great science about COVID in stroke at this meeting.
Great. Thank you. And Peter, as an emergency room physician, you've always been on the front line. So I don't know if you have some additional insights?
I do. Certainly, as an emergency physician, this year's probably been one of the most challenging professionally and personally that I've ever experienced. And I've been doing, as you can see with the thinning hair and grayness, I've been doing this for a few years, but this year has been extremely hard. We all, look back fondly in February when we're in Los Angeles getting on the plane to come home, not knowing a few weeks later that our lives would change really forever in ways that we never anticipated. And really a lot of positive things have occurred this year, and obviously a lot of tragedy. But as an emergency physician, I think we've learned a lot, at least medically and science, as kind of a group of physicians, really in the house of medicine, that we learn to work together, respect our specialties, and as an emergency physician involved in physicians, nurses, and trainees, looking out for each other and protecting our other colleagues in the healthcare system from unnecessary exposures, and really using innovation, telemedicine, iPads in rooms, remote consults, protecting our EMS providers, trying to minimize transfers and be more efficient with our care locally and larger medical centers. It really has just been a fascinating year, and just knowing our thought process a year ago and where we are today, our fears and our knowledge, it's been night and day. And I agree there is tremendous hope with vaccines and herd immunity and really where we're going as a society. And I think the Heart Association, putting my stroke council chair hat on, I think under Mitch's leadership, I don't think he ever realized signing up for this year, what type of a challenge this would be. But certainly the Heart Associations have been extremely, I think, proactive in facing COVID-19, which is an infectious disease and really not the primary mission of the Heart Association. But when you really think about it, it is. We're here to make the lives of everyone better, and COVID-19 kind of impacts every aspect of life, particularly brain health. As a council chair, I was very fortunate to be involved in and kind of work with tremendously energetic and bright people. From the first temporary emergency guidance on stroke centers during a pandemic that came out on behalf of the Stroke Council, issued by Pat Leiden and the leadership group, to other papers looking for pre-hospital guidance, pandemic guidance for stroke centers, integrating endovascular staff into the COVID world, mechanical thrombectomy, COVID kind of hints and best practices. Everyone came together, not only in Heart Association and outside, and was able to put together really, I have papers from the council and council members that tried to really attack this issue front and center and provide guidance to the larger community. And that really has, to me, been professionally satisfying.
Yeah, it's been a challenging year, but an amazing year for growth. I mean, especially our systems of care, telehealth, and we're never going back. So, we've learned a lot, we've moved forward. And Mitch, I don't know if you want to close us out with a little discussion about the American Heart Association's COVID registry.
Sure, I'd love to do that, Louise, thanks. as Peter was saying, I think that the Heart Association really stepped up to try to address this crisis, even though it's an infectious disease. We've all learned, as Tudor was saying too, that this is a vascular disease as well. And so we, fortunately, at the Heart Association, we've had years of experience with these registries, right? And stroke is one of the best examples of this. I think we can be very proud of the Get With the Guidelines stroke registry, which is almost 20 years old, has 5 million patient records, 2,000 hospitals participating. And so with that infrastructure in place, we were in a good position to launch a COVID cardiovascular disease registry, which now has about 160 hospitals participating, almost 40,000 patient records. And the idea is to see what the incidence of stroke as well as other cardiovascular diseases is in people who've had COVID. And so there are results being presented at the meeting this week on the incidence of stroke in patients with COVID. Fortunately, the proportion of patients who do have stroke is quite low, on the order of 1% or less from this large national registry. So it's not a terribly common complication, but it does occur. It does occur more often in communities of color, particularly Black Americans, and it's also more common in people with other stroke risk factors, of course. And having a stroke with your COVID, perhaps not surprisingly, leads to a worse outcome as well. So I'm, thrilled that the Heart Association is able to contribute that data to the conversation about COVID as well. Hopefully that will be helpful as we get ourselves out of this pandemic. So thanks for the chance to talk about that, Louise. Back to you.
Yeah, and I think we're going to be seeing a lot of this in 2022, 2023, because even with vaccinations and herd immunity, the sheer number of Americans that have been affected by COVID and their family members, lost friends, lost family, but also the recovered people, the people who have recovered from COVID. What are the long-term public health impact of having COVID and having symptoms, often called long haul? How is that going to affect our brain and vascular health in the decades to come? So even if the acute pandemic is controlled, we're going to be seeing a lot from this nasty little virus for many years to come. So I'm really excited that 2021 turned out as good as we could have hoped, and I'm glad everybody stuck with us. Some technical glitches, some other issues, but I think overall people learned a lot, people were very engaged, and I think it was a great conference. And I thank everyone for tuning in, and I thank everyone for helping us.